Hello and welcome to the program. I'm your host, Neil Howard, here on Health Professional Radio. Thanks for joining us today and making us a part of. Going to have a conversation with Dr. Gilberto Lopes. He's Associate Director for Global Oncology at the Sylvester Comprehensive Cancer Center that's located at the University of Miami. And he's joining us on the program to talk about a recent FDA regulatory update that approved KEYTRUDA for the first-line treatment of patients with stage 3 non-small cell lung carcinoma. Welcome to the program, Dr. Lopes.
Thank you, Neil, and warm welcome to everybody who's listening to us today.
A bit of background about yourself, a brief background, and then let's talk about this stage 3 non-small cell lung carcinoma and this regulatory update for approval.
Sure. So I'm a medical oncologist, which means I'm a specialist in systemic treatments, chemotherapies, targeted agents, and now immunotherapies for patients with cancer. And I'm a clinical researcher, which means I develop new cancer treatments for patients, in particular with lung cancer, but also other sorts of tumors. And this approval for KEYTRUDA for stage 3 and 4, actually, is based on a study that we initially presented at the ASCO, the American Society of Clinical Oncology annual scientific meeting last year, and that was recently published at the Lancet, which is a very prestigious medical journal, in early 2019. And these are the data and the information that led the FDA to this new approval.
So what about the traditional first-line treatment? What historically was that course of action for lung cancer, and how's that changed over the past couple of years or so, and how is it important that KEYTRUDA is now approved for that treatment?
We're truly living a new era of hope in lung cancer. Historically, without any treatment, most patients that develop lung cancer that's metastatic, that has spread to other organs, would live less than 6 months. And with chemotherapy, we could push that to 8 to 10 months. With a few other new treatments, we could get close to 12 months when we use chemotherapy as a maintenance strategy as well. So historically, we have treated all or most patients if they had a good performance status, meaning if they were strong enough to take chemotherapy with classic chemotherapy, which comes with all of its associated side effects, such as nausea, vomiting, hair loss, tiredness, and a host of other symptoms. Over the last 8 to 10 years, we started to develop targeted agents. And these are agents that help those 10 to 20% of patients that have specific mutations, changes in their DNA that make their cancer cells become what they are. And these are mutations that we know as EGFR or ALK. And for these patients, we actually have tablet treatments that have a lot fewer side effects than classic chemotherapy, and that helps patients live much longer. But these treatments are only helpful for those 20 or so % of patients that actually have these specific mutations. So it hasn't been an opportunity or an option for the vast majority of our patients. With immunotherapies, and we initially started to use these drugs for patients that had failed other treatments, and we're now finally moving it to the first-line treatment. With immunotherapies, we can actually get the survival beyond a year and a half, about 18 to 19 months. And this is a major improvement. In addition to that, immunotherapies for most patients actually have fewer side effects than what patients experience when they get classic chemotherapy. The specific approval that happened now is an expansion of the approval for KEYTRUDA. KEYTRUDA had been approved for those patients that have a marker called PD-L1, which was positive for 50% or cells or more. And the new approval based on our studies that extends that approval to patients with the marker at 1% and more, which is about 2/3 of patients with lung cancer.
Were those the major findings that supported the approval, or were there some more, even more significant findings?
Correct. So what Keynote 42, which is the study I led, showed is that when we treat patients with a PD-L1 of 1% or more, with KEYTRUDA, they do better than if they get chemotherapy, which means that patients were living longer and with fewer side effects, and that was even without treatment with chemotherapy. Since then, we have actually known and learned that patients who receive chemotherapy and KEYTRUDA do even better, and that has become the standard treatment for most patients today, which is actually to use a combination of newer chemotherapy agents, which are usually less toxic than classic older chemotherapy regimens, with KEYTRUDA. So this tends to be our main regimen for most patients today. And with that, we're getting to around 20 months in median survival, which means that about half the patients are living longer than that. It's still not quite a cure for lung cancer, but we certainly seem to be doing much better than we did 5 years ago. Indeed, one study that was just presented about a week ago in Chicago at the 2019 meeting of the American Society of Clinical Oncology shows that at 5 years for the initial study in patients who received KEYTRUDA, this is a study called KEYNOTE-001. In that study, about 15% of patients were alive in 5 years. And that may seem a small number, but when you actually compare to less than 1 or 2% of patients being alive at 5 years with chemotherapy, that is a major improvement. But of course, we still have a lot more to do.
You know, you spoke of treatment along with management during the survival time. As that survival time reaches its half-life, as far as quality of life, is it diminished?
So the quality of life actually improves with KEYTRUDA because most patients have no side effects at all. Patients do have the potential of developing autoimmune because KEYTRUDA is what we call a PD-1 inhibitor. It's a medication that inhibits kind of the brakes in the immune system so that our own immune cells, our own defense cells can go and fight cancer. When we do that, sometimes that can also make the immune system a little bit more prone to attacking normal cells, but that happens in a minority of patients. And overall, the quality of life of patients on KEYTRUDA is much better than the quality of life of patients on chemotherapy.
In your opinion, what impact do you think that this expanded indication is going to have on clinical practice as a whole?
This will definitely give us an option so that more patients can have access to immunotherapy.
Is there a place online that we can go and get some more information about Keynote and also about KEYTRUDA in general for those who may not be familiar with KEYTRUDA or this recent updated approval, and also about the Sylvester Comprehensive Cancer Center as well?
Absolutely. So sylvester.org is a website where you can find more information about our cancer center. And for patient information in general, I usually suggest cancer.net, which is the website for the American Society of Clinical Oncology page for patients. And that usually has a lot of information about cancer diagnosis, staging, and treatment, and can be useful not just for lung cancer, but for a number of diseases. And they have detailed information, and that's cancer.net.
Right. Dr. Lopes, thank you for joining us here on Health Professional Radio this morning.
Neil, thank you very much, and hope everybody has a good day.
You've been listening to Health Professional Radio. Transcripts and audio of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to this podcast on iTunes, listen in, and download at SoundCloud, and be sure and visit our affiliates page at hpr.fm and healthprofessionalradio.com.au.
Thank you for listening to Health Professional Radio. We're very proud to be an independent broadcaster providing our content free of charge to you, the listener. One of the ways that we're able to remain free and independent is by having people like you become patrons. You can support Health Professional Radio simply by visiting hpr.fm and clicking the button that says Become a Patron. Your patronage of even just $1 a month lets us know that you're there, which in turn makes us more valuable to advertisers. And, of course, if you're able to afford more, then we would certainly appreciate the support. My name is Toby Longhurst from Health Professional Radio. Please visit hpr.fm, click the Become a Patron button, and support us if you can.